lang, magpuyat ka ng 2 gabi ang oily na ng face mo. So,
Yeah.
it's similar to that scenario. Bakit tayo nagkaka-acne when we have pagpuyat tayo or we're stressed?
Hey everyone, I'm Dr. Kristine Alba Kiat, and this is Chat with Peds, where I interview experts in the field in order to empower you and give you the confidence to raise happy and healthy kids. My guest is a colleague and a good friend, Dr. Louella Fatima Ramos. She is a board certified dermatologist of the Philippine Dermatological Society, and she's also the chairman at Southern Isabela Medical Center, Department of Dermatology and Venereology. She's a wonderful resource for any questions I have about my patient's skin and my skin as well. Join me as I welcome Doc Ola. Hi, Doc.
Hi, Teen, and hi everyone who's watching the YouTube channel of Dr. Teen Kiat.
Yeah,
Thank
thank
you for inviting me. It's an
you.
honor to be part of your show.
You're so busy. It's so hard to catch you, Doc. So I'm so glad
I
matutuloy na tayo.
see.
So, Doc Ola, at what age can kids get acne? Kasi may, di ba merong teen acne? Iba pa ba to sa adult acne?
Okay, so teen acne, when I have patients na teenagers, okay, I explain it to them in such a way that they would think na it's normal, it's physiologic, okay? Kasi di ba, pagka-adolescent period, you have the secondary sexual changes, and one of them is the stimulation of your sebaceous gland. So, when you stimulate the sebaceous gland, there is more sebum formation. So remember, sa pathophysiology natin kanina, the more sebum produced, nakaka-contribute siya doon sa formation of the keratin plug. So I tell them that it can be part of their changes in adolescence, okay? So, but usually, teenagers get a different type of acne earlier stages, especially sa mga females, a few months before they get their menarche or their first menstrual period, nagkakaroon na sila ng mga whiteheads and saka blackheads. So sometimes when their parents bring them na for consult, that's one of the first few questions. If I have a female teenager, have you had your first period already? Because if not, most likely in a few months, at the most around 6 months, you're gonna have your first period
Okay.
na.
That's
Okay?
nice to know.
Yes. And usually, it's on the forehead, dito sa may T-zone. This is the T-zone area of the face. Yan usually nagkakaroon ang mga teenagers. And for adult type naman, it's usually sa adult female type, di ba sometimes marami akong patients, kung kailan po tumanda, nagkakaroon pa rin ako ng pimples, di ba? Feeling nila ang mga ano is just for teenagers, but it's
Years.
not. It can happen sa So during the pandemic, there was really an increase of number of patients with masked knee because of we wore the mask, okay? Masked knee is a type of a mechanical acne. Pagka mas na-obstruct pa yung skin mo because of wearing mask. Then sometimes the mask itself is irritating. So nakakadagdag yun. Tapos 'di ba, nakamask ka, yung very humid, yung occlusion brought about by the mask, lalo na nagde-double layers pa tayo. So talagang nakakadagdag talaga siya ng
Nagpapawis
mask.
din po.
Yes, kasi 'di ba when you breathe, when you talk, yung mainit, humid yung air, yung ano mo doon. So yun yung one of the causes. And until now we get patients, pero especially in the hospital, because the healthcare workers are still required to wear mask sa hospital. So meron din yon. And other causes of acne, syempre those who are taking certain medications, sometimes yung mga different type of oral contraceptive pills, dumadaming acne nila instead of nagagamot, because it depends on the type of the oral contraceptive pills, kung ano yung mas maraming estrogen, mga ganon. And sometimes when they use certain mga cosmetics, acne cosmetica, we call that, Kaya 'di ba when you buy your cosmetics or anything hair skincare products, make sure na that it's not comedogenic kasi sometimes the things that we apply on our face, minsan foundation pa lang or the other stuff whatever, they could actually be causing more acne and triggering outbreak of our acne. So, yes, you can have acne at any time. Actually, yung neonatorum, yung
So,
kumisan yung mga
baby.
babies.
Opo.
Oo, 'di ba? Pero that's due to the hormones na pass on pa from their mother, pero nawawala din 'yon. So, as early as a few weeks, a few months before the menarche of a girl, of a teenage girl, nagkakaroon na po ng acne. And you can have acne because there are a lot of triggers for acne. So, at any age, actually, pwede kang magkaroon ng acne.
Oh, really? Oo nga, inisip ko, at my age, bakit may pa
O, di ba? We still get, yes. Especially when we're on this topic na rin. So, what are the triggers of acne, di ba? Kaya nga, bakit naman kahit anong age? Kunyari, akala natin pang teenagers lang yan. So, uh, I would say the most common pa rin, other than those I've mentioned kanina that would trigger acne, still stress, okay? And I always say it's not the physical stress because physical stress, when you sleep, pagising mo, refresh ka na. But it's more of the psycho-mental stress. Like, kunyari, puyat ka, pagod ka, and you have a lot of things going on in your mind. That kind of stress really, 2 days, 3 days, meron ka ng acne. So, why?
Totoo po
Because
yun,
when,
Dok.
diba? Yes, because when you're under a state of stress, diba, what happens to your body? You have an increase in your stress hormone or your
Cortisol.
cortisol. And this stimulates your sebaceous gland. So remember do sa pathophysiology natin kanina, si sebum gland or oil gland, actually, pag natitrigger siya, nagkakaroon din tayo ng acne. Isipin mo lang, magpuyat ka ng 2 gabi, ang oily na ng face mo. So,
Yeah.
it's similar to that scenario. Bakit tayo nagkaka-acne when we have pagpuyat tayo or we're stressed or simply marami tayong iniisip sa buhay, parang ganon. So it's sometimes those are the things that we have to explain to patients para they would understand that sometimes even if they're already undergoing treatment, masipag naman silang magpahid, masipag silang uminom, masipag silang magpa-consult, they still have those breakouts or nagfa-flare because of the certain triggers which are not considered. They do not avoid the triggers. So that's one of the important parts of management of acne.
So, Doc Ola, for patients who want to reach you, how can they reach you?
Yes, actually Mondays to Fridays, I'm at the Southern Isabela Medical Center, Department of Dermatology and Venereology. We actually have our dermatology center there, and we have a lot an array of treatments if you have for your dermatological needs. Hindi lang acne, actually marami po. We have a wide range of services for your needs, not just the aesthetic po ha, but your pathologic diseases. We cater to them. And on Saturdays pala, Saturday sa Matbay Private Clinic at the Heritage Building, Room 216, every Saturday afternoon lang po. And if you cannot, if you have quite urgent needs and would prefer to have an online consult first, you're free to check out the Facebook page of our department. Just type in at SIMC, capital letters SIMC, capital letter D, and then small letters ERMA for our page. And we would gladly answer your queries, your teledermatology questions. So that's at SIMC Derma. That's our page.
All right. Thank you, Doc Ola, again.
Thank you, Tin.
Bye.